So now we'll switch across to the other side of the world to Manisha in Nepal. And Manisha is a nutrition specialist working with FHI 360, a public health professional with 8 years of experience in health and nutrition design, program design, implementation and research. So she's going to give us her reaction to the tool. Over to you, Manisha.
Julie, am I audible?
Yes, sorry, yes, we hear you very well.
Thank you so much. Thank you to Julie and the entire research team for providing this opportunity. Good afternoon and good evening for whichever part of the world you are. I'm Manisha Shreshtha, and as Julie introduced me, I am a mother and also a nutrition specialist. I'm currently working with FHI 360 for a Suhara program, which is a multi-sector nutrition program funded by the USAID. So talking about the tool, I kind of personally felt very related to this tool, because being a mother, like in developing settings like our, breastfeeding is actually considered as a responsibility of a mother. So, having to add that economic value to what we have done, of breastfeeding, I feel that, whatever we've done to our child through breastfeeding is now actually going to be acknowledged by the government. So talking about this tool, this tool is going to be a very nice advocacy tool, especially for the government and the policymakers, because, nobody has ever thought about, breastfeeding could actually be converted into, economic tool, or the economic value of the women's care for breastfeeding could actually be calculated. So this tool is going to be a very wonderful tool for advocacy for the government and the policymakers. Nepal is actually beginning to start a human milk bank in our country. So I think this tool would be a very nice advocacy tool for establishing human milk bank, and also establishing or kind of another milk bank in other part of the cities and countries. Also help in kind of extending the maternity protection or the maternity leave. We just have a maternity leave for 3 months in Nepal now. So probably this tool would also be very helpful to advocate government to extend the maternity leave in the country, and for other budget allocations related to breastfeeding. Talking about the tool, thanks to Alexandra for walking us through the tool. It's very user-friendly, it's very easy. Anybody can use it, even the mothers or anybody can use it. It's very simple, it's very easily created. It's provided very clear instructions and guidelines. So it's not hard to kind of, enter the data and populate the data. And, it kind of populates an infographic, which is also very interesting at the same time. And anybody can grasp it very well. And I love the advocacy button that you've added. Initially, it was not there. So, you can, enter the data at the same time and also have the advocacy brief at the same time immediately. I think that's awesome. That's awesome. So, just a few not exactly, I wouldn't say the feedback, but just a few queries that I had regarding the tool is, when Julie mentioned in her presentation that, the tool is going to be used for children 0 to 3 years of age. As far as I know, for the DHS data, we calculate for children 0 to 2 years of age. So is there any particular reason as to why children for 0 to 3 is considered? Because once the child completes 2 years of age, the breastfeeding rate kind of declines. I think that's true for all other developing countries. So any particular reason as to why children from 0 to 3 is considered? And another is, once you start complementary feeding, the frequency of breastfeeding kind of declines. So, the volume and the frequency declines. So the cost would also kind of alter depending on the volume and the frequency. So has that been taken into consideration while developing the tool? But since it's just an advocacy tool, just wanted to ask if that's taken into consideration while developing this tool. Thank you, Julie. Over to you.
Thank you, Manisha. And those questions are important. We use the UNICEF data, which actually does provide information for many countries through to 3 years. And as I mentioned regarding Indigenous breastfeeding historically, it's actually not more normal to continue breastfeeding 3 years and beyond, part of our human evolution. So any further questions, keep posting them in the chat, because even if we don't get to them tonight, we will use them to develop our frequently asked questions.